Hello, my name is Berry Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing very important healthcare topics. So today our show, we're going to be talking about the hospital's patient portal, and Jodi Frei is here as our guest. She is the manager of clinical informatics at Northwestern Medical Center, and she's worked at the hospital for 13 years. She first got her start at Northwestern as the Rehabilitation Services Manager. And then, with being a physical therapist, she moved into the computer world of informatics. And so this involves the use of information technology to deliver healthcare services. So Jodi, thank you so much for being here to talk about the patient portal and this whole world of computers and how it's sort of taken over and replacing the good old paper. Mm-hmm. So we don't want to let go of that paper. So
we don't. No, it's a difficult transition.
That's right.
Thank you for having me.
Yes, it's our pleasure. So talk a little bit about yourself first. I know you're a physical therapist, so how does a physical therapist, become someone who is working with computers?
Sure. Well, had you asked me that 25 years ago, I don't know how I would have answered that. I did graduate from University of Vermont in 1990 as a physical therapist. So I've been in healthcare now for about 25 years. Shortly after I graduated, I stepped into a management kind of leadership role. So I enjoyed many years of treating patients while I was helping to lead a variety of staff members through a variety of initiatives, and that was really fun. I've been at NMC, as you referenced, for 13 years now, and many of those years have been in the arena of rehabilitation services or different types of therapies. I implemented an electronic medical record in rehab shortly after starting here at NMC, and that really sparked my interest in this concept of using technology to improve the outcomes, to improve our patient outcomes. So I had a little bit of a taste for it when I first started as a rehab manager. And about 5 years ago now, when Northwestern Medical Center—
It's been 5 years?
Yeah, it has. When we really started to embark on using technology throughout the house. At that point in time, our nurses on the units were using a paper chart, our physicians were using a paper chart, and we knew that what was important was to create a medical record that worked for our clinicians and an electronic medical record that worked ultimately for our patients. And so I was drawn into that, and I was drawn into this concept of evolving technologies, that our computer systems are going to evolve to the point that we can provide the right information to the right people at the right time so that they can make really sound clinical decisions for our patients. So I kind of evolved into information technology from rehab services and really used that the clinical knowledge that I have to represent what the needs of the clinicians and the physicians were, and to make sure that we really did the right thing for our patients with the build and implementation of our electronic medical record. I knew it was not going to, it was going to be challenging, but it was something I was up for and really wanted to help Northwestern Medical Center with. So since then, I have I've been in a master's program for information technology, and I'm happy to say that at the end of next month, I'll have my master's in information technology as to balance out my clinical education. So I really enjoy this blend of leadership and information technology and the clinical, it all comes together, and it all comes together ultimately for our patients. So
excellent. Well, we're going to talk a little bit about the patient portal.
Sure.
So if we could focus that, because when we think about providing this information to the community, so what is the patient portal and why would someone want to have access to it?
Sure. The patient portal essentially is an extension of our electronic medical record. We talked about the evolution of Northwestern Medical Center and the development of our electronic medical record. Whenever a patient is admitted to the hospital for an illness or an injury, or a patient arrives at one of our physician clinics in the community, all of the care, all of the treatment, all of the procedures that are performed, all the information that we gather from the patient is documented within our electronic medical record. Our patient portals are the means by which patients can access this information. So why would a patient want to access this information? In my mind, the short answer is that this empowers the patient. This gives the patient the information that he or she needs to know about his or her medical history, any procedures, any lab, x-ray results. I think about the importance of the patient portal in a couple of different ways. If we think about the patients that are admitted to the hospital for an illness or an injury, it can be a very challenging time for our patients. They don't feel well when they first arrive at the hospital. We help them recover, but there's a lot of information that the different clinicians share with the patients, as they're leaving, as they're transitioning home. And that can be a little overwhelming at times, to remember and understand all of the directions and instructions and future appointments that are being explained to the patient at that point in time. So I know even in my world with a clinical background, there have been times that I hear physicians give me information about my children and I forget the moment I walk out the door. So the patient portal is a means for the patient to access in writing or electronic form. Here are my discharge instructions. The patient may forget, when is my follow-up appointment with my primary care provider? When am I allowed to take a shower? When can I put weight on my leg? Which medications was I supposed to start and which medications was I supposed to restart?
So that's all in the
It's all
in that
on
record?
the portal. Yep, it's all in the hospital patient portal.
So how do they get into it?
How do they get into it? Well, we give patients information when they're at the hospital or when they visit the physician clinic, with instructions on how to access the portal. We also have a key staff member that we actually added staff members to our team when we went live with the patient portal, specifically to support the community in accessing this patient portal. We're that invested in it. So Penny LaFlame is a relatively new member to our team, and she is on the other end of the phone. Patients can call 524-1260 and ask for Penny, or just ask for support with the patient portal. And Penny will walk patients through step by step. She's even met patients at the front lobby, person one-on-one, to help people see and understand how to access the patient portal. Once people log on to our Northwestern Medical Center org website, there's a link to the patient portal. And if the patient gets stuck in the process, there's a button that says Contact Us.
Oh, good.
So they can also launch into that Contact Us link and just say, I need help. And Penny will reach out to the patients and call them and walk them through whatever.
That's a personal touch. That's terrific.
Yeah, it's been wonderful.
Now, so is my information confidential? I mean, who has access to all of this?
Yeah, I'm glad you asked that question. How secure is my information?
Exactly.
I understand that there's a lot of anxiety, or there can be a lot of anxiety nowadays about sharing your personal information over such things as portals. And I'd like to assure you that our patient portal is secure. Most importantly, it's a password protected system. So every patient, when they first enroll in the patient portal, patients are given a one-time password.
Okay.
And we may be able to see on the NMC side this one-time password, but when the patient uses this one-time only password, they're then prompted with a variety of security questions that only he or she would know. People are probably familiar with these if they've accessed any other type of system. What's your maiden name? What's your favorite movie? Certain number of questions, security questions, and then they change their password.
Okay.
So that it's unique to them, and we suggest that they not give that password out to other people. We at the hospital don't even know the patient's password at that point in time.
Okay, great.
So we also implement industry standard security efforts, and one of those techniques is called encryption. So even if somebody were to attempt to hack or attempt to try to sneak into our system and get information out of it, the information that they view would be jumbled. It wouldn't make sense to them because we've implemented something called encryption. So we do take efforts to secure all of the patient information that's contained within our electronic medical records.
Excellent. That sounds great. That builds my confidence as I talk about it in the community that it's okay. So that's terrific. So can I make an appointment or talk to my doctor directly through this portal?
Yeah. The portal is interactive, so you can request an appointment. You can, when you're in the patient portal, there will be a tab or a box that says appointments, and you can go into this tab or a box and you will see all of the appointments that are pending, all of your future appointments that are scheduled. It also gives you an opportunity to request an appointment. So you could go into the patient portal and say, I am a patient of Sarah DeSilvi's, or I'm a patient of Dr. Essenler. I would like an appointment. You can also give us some specifics. You could say, this is the time of day that works best for me. And we will give you a call. There'll be somebody on the receiving end of that message he'll receive your request, and we'll give you a call. We'll schedule that appointment at a time that works well for you, and use that as an opportunity also to explain any other information that you may need to know, what to bring to your appointment, when to arrive, and so, yeah.
Excellent. Wow. Yeah. This is the information age.
It is. It is.
That's great. That easy access to your own information. Yeah. So can I change the information in there? Is there anything I can change?
You can't directly change it, but we hope that people will provide us with updates.
Okay.
So when you access your patient portal, you'll see a list of your medications. You will see a list of your health history. If anything changes, if you go to a physician outside of the Northwestern Medical Center community and that physician discontinues or starts you on a new medication, then you can go into your NMC patient portal and let us know. You can send us a message and say, I am no longer on this medication. Please update my medication list in your system. Or you can say, I had a procedure, and so can you add this to my health history? You may add an allergy. You see your allergies. You'll say, oh, I now have an allergy to this particular medication. Please update the history. That's very important to us at the hospital. We will ask you those questions when you're next, with us face to face. But it's important. It's just wonderful for you to be able to give us that information through the patient portal. And somebody clinical, maybe your physician, it might be a nurse on your physician's behalf, will look at the information that you've presented to us and either update the record at that point in time or wait until you come in to ask you some follow-up questions about that.
Okay, that's terrific. So when I think about all of this information and I think about the computers now, my mind goes into the actual visit, and the physician or the nurse, there might be a computer there.
Yes.
And how do we better, improve the eye contact to keep that personalization of care that's so important to us and to the patient? But you got a computer there. So how have you helped folks like nurses and doctors do that dual activity?
Exactly. Well, the first thing I've done, being a clinician who started, I mentioned, many years ago with a paper record, transitioning to a medical record, I've kind of lived that from the clinical perspective as well. And a strategy that worked well for me that I suggest to others is, before you had a pad of paper, now you have a computer. So I've handed you a different means to document, but really make sure that you're still attending to the patient and involve the patient with that whole experience. So I often suggest that people tell the patient, this is what I'm documenting. I ask you your health history and you tell me about your procedures and your surgeries or any illnesses that you've had in the past. And I suggest to people that they say, okay, so I'm now making note of what you just described to me, or I'm going to check the motion in your leg, and now I'm documenting the motion or the goals that we have for you. This is where we want you to be in another 3 months. We may be talking about preventative medicine and how can we help to prevent further exacerbation of diabetes. So this is the goal that we may establish.
Super.
If I'm documenting, I sometimes think about my airport experience and the person behind the kiosk who may be typing, and I really have no idea what they're doing. So I try to help people to engage the patient and maintain that eye contact. And I need to tell you that it's difficult. Transitioning from a pad of paper that you've used for your entire career to a system is difficult. And sometimes when we're first going through that transition, even the providers you're a little nervous, you're trying to figure out this new system, how does it work, and inadvertently they may just be really focused on the computer, but as they become more comfortable with it, then they start to kind of take a deep breath and re-engage the patient. So we often ask patients for some consideration or forgiveness when we're in those transition phases. And I think a lot of it's just around providing feedback and helping people to understand it's okay, just don't put the computer right in front of the patient. Put it over here.
Well, computers are part of our lives, and it's now wonderful to see how far we've come to give patients access to their information. So Jodi, you've been a wonderful guest. So thank you so much for talking about how computers are so involved now and so important in the care of the patient. So thank you so much for being here.
It's my pleasure.
So this is Berry Bowen. I'm CEO of Northwestern Medical Center. Thank you for joining us to talk a little bit more about computers and how computers are helping in the care and access to patient information. Thank you.